Kerstin. I'm Senior Research Scientist. For my background, I did an undergrad degree in physics and then later did a PhD in neuroimaging here at the University of Queensland. I then went over to the UK to do a postdoc at Imperial College London and then came back to Australia in 2016 to work as a postdoc with the CSIRO, Australian eHealth Research Centre. I've continued working there since then. And I've recently joined QDEC as a senior research scientist in August. Now, my research focuses on preemie babies. And these preemie babies, they have a whole range of acute risks. And once the baby makes it home from the NICU after a couple of months, you still, as a parent, have to keep worrying about them because they might end up with learning difficulties, they might end up with autism, ADHD, cerebral palsy, and other motor conditions. So you keep worrying for years to come. And the early years are a very important time in a child's development because that's when the brain is at its most plastic and when any intervention has the best chance of improving their outcomes. Now, the challenge is to apply those early interventions, you have to be able to identify which baby actually needs which intervention. And that's where I come in. So I use brain MRI very early in life. We're looking as early as 30 weeks post-menstrual age. That's 10 weeks before the baby's due date. And we take an MRI. We take another MRI again at around the term equivalent age. And you can see here in the images, that's the same baby with the MRI taken 10 weeks apart. And you can see how drastically the brain changes from a very smooth appearance to a highly folded appearance. And we're looking at the small changes that might differentiate them from the healthy babies. So not looking at the strokes and the intraventricular hemorrhage and those sorts of things, but looking at the smaller details that give us other clues that you might not see on conventional MRI. And my special area of interest is in diffusion MRI. Now, diffusion MRI is really cool because it gives you colored pictures, so that always is nice because you can show something beautiful. But it also allows you to look at the brain microstructures, look at myelination quantitatively, look at the organization of the brain structurally, look at how the different areas of the brain are connected. And my goal is to put this information together with all the clinical information that we have about the baby, put all of this in a big AI model, and then be able to give the parents the information that they need. Is your baby in need of early intervention, or put them at ease? Your baby is likely to not need early intervention. Now, the impact to date, I realize this is a little bit small. The thing I'm proudest of so far is that what I have done is I've modified the diffusion MRI acquisition protocol so that the data we are getting is better. So babies in a noisy MRI machine, they wake up, they move. We're not sedating them, there's no anesthesia being used. So there's gonna be interruptions in there. The baby's not well, something's going to happen. So what I've done is improve the MRI protocol so that we can interrupt, we can reacquire, and we get better research data. This is not in the clinic. We're quite far from getting it into clinic because those babies are very fragile. So not every baby is able to get an MRI, but this is the ultimate goal. Get an MRI for every baby, ideally on the bedside, and integrate it with the other information that we can get to get an early diagnosis. Thank you.